These are some of my favorite celebrity analysis videos of 2024. Please enjoy. Demi Moore has captivated audiences for decades with her timeless beauty and unforgettable performances. But as with many stars in the limelight, rumors swirl about the secrets behind her seemingly age-defying appearance. Let's take a closer look at Demi Moore's facial evolution over the years, examining the speculation surrounding whether she has undergone plastic surgery to maintain her stunning looks. In 1981, at the age of 19, you can see that Demi has high full brows. She has these big open eyes, and she has a non-bulbous tip. I know that some of you comment that I always say that everyone has a bulbous tip. Well, in this case, Demi does not have a bulbous tip in my opinion. Her mid-face and her lower face have a strong bony structure. Demi has well-defined philtral columns, and she does appear to have a thinner upper lip. In 1982, at the age of 20, I would like to point out here the natural boundaries for the eyes, the mouth, and the cheeks, and what happens when we overfill with filler, these boundaries get blurred, and you'll see that as time goes on, there are some blurred boundaries that occur with Demi's face. In 1983, at the age of 21, Demi has a slight dorsal convexity, which is a small bump on the bridge of her nose. But this does not take away from the beauty of her nose. In 1984, at the age of 22, I see no change, and that's the same through 1985. In 1986, at the age of 24, I'd like to point out the upper tooth show that Demi has on repose. When she parts her lips, you can see quite a bit of upper tooth show, and this is generally a more youthful, sensual type of look. It appears to me that Demi may have had a brow lift around this time. The brow is now positioned above the brow ridge, and this persists for many years. In 1987, at the age of 25, when you look at Demi's central hairline, there appears to be a thinner area there, but that is where her natural part line is. And everyone at the natural part line will have a thinner appearance to their hair. Some people come to me asking for a hair transplant to thicken up an area like that. But the problem is that even though you can get it a little bit more dense with a hair transplant, it'll always appear to be the thinner portion of your hair. And that's because the hair is going in opposite directions. If you try to transplant in a different direction, then you start to lose naturality even though you've placed more grafts into the area. So there's a limit to how much thicker you can make a natural part line appear. In 1988, at the age of 26, I see no change, and that's the same through 1989. In 1990, at the age of 28, I wanted to point out here the excellent jawline definition that Demi has. And a lot of that is attributed to the strength of her mandible, or the lower jaw. In 1991, I see no change. And in 1992, at the age of 30, there is lateral eyebrow descent. And that is because she's now in her 30s, and that's a very common time for the tail of the brow to start to sag, even though it's very slight. In 1993, at the age of 31, Demi's face is starting to appear fuller, and this is likely because she was pregnant around this time. In 1994, at the age of 32, I see no change, and that's the same through 1998. In 1999, at the age of 37, you can see that her nasolabial folds are starting to deepen as the aging process is ongoing. In the year 2000, at the age of 38, I see no change. In 2001, at the age of 39, you can see the temporal hollowing that's starting to occur. And this is an area that can be filled, but you have to be very careful not to overfill it, because if you have the temple region starting to protrude more lateral than the lateral cheeks, things start to look very artificial. In 2002, at the age of 40, it looks to me like Demi may have started to do some Botox around this time, and this is to the usual areas, the forehead, the glabella, and the crow's feet. In terms of dosages, usually the forehead will take about 15 to 20 units. When it comes to the glabella, you're looking at about 10 to 20 units depending on the strength of the muscle. And when it comes to crow's feet, A standard dose is about 20 units combined for both sides. In 2003, at the age of 41, I see no change, and that's the same through 2005. In 2006, at the age of 44, you can see some early signs of cheek descent, and this is in part due to gravity and in part due to volume loss that occurs as we age. You can also see that Demi now has some neck skin laxity that is forming. In 2007, at the age of 45, I see no change, and that's the same through 2009. In 2010, at the age of 48, I wanted to point out that Demi has flawless looking skin. And part of that has to do with protecting your skin from sun damage and a lot of sun exposure. So using sunscreen regularly is very important. And of course, basic skincare, such as using a facial moisturizer, a facial cleanser, and like an HA serum is very good for maintaining excellent skin. We have some of those products available on the Feel Confident website, so make sure to check that out at feelconfident.com. In 2011, at the age of 49, I see no change. In 2012, at the age of 50, I'm seeing some signs of an upper blepharoplasty. This is a procedure that removes some excess upper eyelid skin. And what it tends to do in some patients is to cause some degree of hollowing of that area under the brow ridge. So you can see that occurring in Demi's case. So while the eyes might look more youthful in that they become a bit more open, that area up above, as it becomes more hollow, can actually cause a more aged type of appearance. In 2013, at the age of 51, I see no change, and that's the same through 2015. In 2016, at the age of 54, I think this is where Demi may have started to get some cheek filler. When you compare back to, say, age 21, you can see how the cheeks appear more full, especially in the medial section, closer to the center of the face. And this is where I find a lot of people over-inject. They put too much emphasis on that medial cheek. They create a heaviness here and oftentimes might under-inject the lateral cheek. So what you get is an appearance that doesn't exactly match the more youthful version of the person. And adding filler to the medial cheek can sometimes contribute to the appearance of aging, because as we get older, the volume starts to get more emphasized in the medial region as the cheeks come down and in. In 2017, at the age of 55, I see no change, and that's the same through 2018. In 2019, at the age of 57, you can see that now with Demi getting filler into the medial cheek, especially over the course of several years, there's now this overinflated appearance. And when we compare back to a similar angle from, say, 1990, you can really tell that there has been a significant change to how her face looks now compared to when she was younger. And it's not just because of aging, it's because of the introduction of filler. Remember that filler doesn't often just dissolve on its own, as we were told when filler first came out by the different companies that make them and by many of the providers that inject them. We now know through various MRI studies that these fillers, these HA fillers in particular, tend to hang around and they can migrate and it can move into other parts of the face as we get older. So they can be dissolved, but oftentimes they tend to build up over time and start to distort the face to a degree. In 2020, at the age of 58, I'm seeing some introduction of potential lip filler. To me, Demi's upper lip looks a bit fuller than it did in the past. And there's a lot to say about 2021 when Demi's 59 years old. First, I see some signs of a potential brow lift revision. For many years, the brow lift that she may have gotten much earlier in life, around age 24, has held up for decades, it seems. And then with the slight descent of the brows, it looks like she may have had them re-lifted. I'm also seeing some evidence of a potential facelift procedure. When I look at the sideburns, it looks to me like the hair is partially gone. You can see the level of where the hair is starting. It matches up a little closer to the lateral canthus of the eye, whereas in the past, it was definitely extending lower than that. And we know that with facelift surgery, some of that sideburn hair can be lost. And sometimes we can do a hair transplant to actually bring some of that hair back. And it can also cover up some of these scars. And we have a YouTube video on that subject. Also, I'm seeing some changes to Demi's tragal region, as we talk about in many other videos about facelift surgery. Oftentimes the tragus and the skin in front of it just appears different after a facelift surgery. And some of it can be that the tragus can be in a shotgun type of configuration. As the skin stretches back, you can get a pull on the tragus, kind of opening up that region. And other times you have extra skin that's laid over the tragus, so it kind of looks like a bit of a pancake type of appearance in front of that tragus. So I'm seeing some of those changes here. It also appears that some of that cheek filler that she's been getting over those preceding years has really built up, and so now there's basically an elimination of the perioral boundaries. So the mouth region that's supposed to be separate from, say, the cheeks is now a kind of a fused zone, and so you don't see those clear boundaries. And something else that I'm seeing here is that as the cheek starts to come down towards the perioral region, it starts to weigh down on the lateral portion of the upper lip, and that can bring the corners of the mouth down, increasing also the upper lip arch. We have a video on frowning and things that can make the mouth appear more frowny, and this is a more rare type of cause, I would say, where the medial cheek filler is starting to extend into essentially the upper cutaneous lip, creating a bit more of that arched appearance. In 2022, at the age of 60, I think that perhaps Demi is starting to reduce the cheek filler volume that she had, and this is giving her a bit more of a natural appearance once again. And in 2023 and 2024, I don't see any other major changes. The total cost of these potential facial plastic surgery procedures is $285,000. From her life as a model to the First Lady of the United States, Melania Trump is no stranger to the spotlight and to the public scrutiny that comes with it. But has the former First Lady ever had plastic surgery, or are her model-esque features all natural? Today, we'll be exploring Melania Trump's facial transformation. In 1987, at the age of 17, what we see here is that Melania Trump has full eyebrows and her eyes are more almond-shaped. When we look at her nose, we can see that the tip has some natural bulbosity, and she has a balanced upper lip to lower lip ratio, and her lower lip appears fuller than her upper lip. She also has strong facial bony structure, so both her maxilla, or where the cheekbones are, and her mandible, where the chin and the rest of the jawbone is, are both quite prominent. In 1998, at the age of 28, what we see here is that Melania's upper horizontal third is longer than her midface and her lower face, and she also has a widow's peak at the hairline. You can see that she's sporting thinner eyebrows now, and this was the look of the 90s. I'm also seeing that her nasal tip, to me, looks less bulbous, and the dorsal hump, this area right at the top of the bridge, is less prominent. So I suspect that she may have had a possible rhinoplasty sometime between the age of 17 and 28. With rhinoplasty surgery, oftentimes the bridge of the nose is narrowed and the hump is removed, and the tip is made to be smaller. Both can be adjusted with a cosmetic rhinoplasty, and sometimes cosmetic rhinoplasties are done alongside a more functional rhinoplasty, where attempts are made to improve someone's nasal breathing as well. In 1999, at the age of 29, I wanted to point out here that Melania's left side of her face appears to be higher than the right side. When we look at her eyebrows, the level of the orbit, the nasal ala, and the oral commissure, they're all slightly higher on the left side compared to the right. And we all have this type of facial asymmetry. It's very, very common. I also see signs of potential lip filler that have been placed into her upper and lower lips. To me, they appear fuller, and around this time in 1999, this was before HA filler was actually FDA approved. The first FDA approved filler for the face was Restylane in 2003. So what was more popular to inject around this time was collagen and microdroplet silicone. In the year 2000, at the age of 30, we see some of the signs of her past possible rhinoplasty. We see more nostril show on frontal view, which is a very common feature after a rhinoplasty. When the nose is secured and the tip is slightly elevated, usually what happens is that the nostrils become more visible, both from a frontal view as well as a profile view. And along the bridge of her nose, you can see where osteotomies were likely done. And those are the bony cuts that are made to try to narrow the bridge of the nose. Also, when you reduce the nasal hump, you can get something called open roof deformity, where you create essentially a flatness to the nasal bridge. So in order to recreate some three-dimensionality and that more pyramid type of structure to our nose, what helps is to do these osteotomies so that you bring the bones back together. In 2001, at the age of 31, I'm seeing full tooth show on smile. In 2002, at the age of 32, what I see here is upper tooth show on repose. So when Melania just parts her lips, we can see the upper teeth quite visibly. And her philtrum, or the distance between the base of the nose and the tip of the Cupid's bow, is now longer than it was in her teenage years. Now, this could in part be due to the aging process. As we get older, our skin expands and lengthens, and because of that, the philtrum can appear longer. But also, people who've had a rhinoplasty can sometimes see that the philtrum gets longer as well. And this is because some of the fibers of the orbicularis muscle that encircles our lips actually interdigitates or connects to the base of the nose. So anytime the base of the nose, or for example the tip, is manipulated in surgery, some of those fibers can be released, and that leads to the potential philtral elongation. And many patients come to me looking to shorten the length of their philtrum with a lip lift. In 2003, at the age of 33, I wanted to say here that Melania has beautiful skin. And some of that, of course, has to do with sun protection and just natural genetics. But part of it, of course, has to do with skincare and how we properly moisturize our skin and care for our skin. Please make sure to check out our high-quality skincare and hair care products that are available at affordable prices. We built these up from scratch with incredible chemists and manufacturers, and we want you all to try them. In 2004, at the age of 34, what I'm noticing here is that Melania's cheeks look more full, and I wonder if perhaps she's had cheek implants, because there's so much regularity to both of the cheeks now, and there's more projection, that I think it would have been hard to get to this state with filler alone. So perhaps she had cheek implants inserted to augment her already full cheekbones. Alternatively, some people get HA filler placed into the cheeks, and some people get fat transfer performed to the cheeks to further enhance that zone. In 2005, at the age of 35, I see no change, and that's the same through 2006. In 2007, at the age of 37, Melania's eyes here start to appear smaller, and this has become a more characteristic trait of her face. Now, this can be due to a number of reasons, and I speculate on a few of them in this video, but the first possibility is that she may have had a cantoplasty or a lateral brow lift that would have brought out the sides of her eyes, and some people call this a cat eye type of look. Other people call it having the eyes be even more almond shaped, but they all have the effect of lengthening the eye and making the eyes look smaller. I think she also may have started to get some Botox to the forehead, glabella, and crow's feet around this time. In 2008, at the age of 38, we again see that the eyes appear smaller. So other than the cantoplasty brow lift theory, it's also possible that the Botox itself may have been causing the eyebrows to weigh more heavily on her eyes, creating that smaller aperture. Remember that the frontalis muscle is the only muscle that actually elevates our eyebrows. So when you heavily inject neurotoxin into that muscle, what happens is it gets more paralyzed, and as that occurs, the brows start to weigh down, And as that happens, then the eyes might start to appear smaller. And it could also be, of course, a combination of these factors that led to a smaller eye appearance. In 2009, at the age of 39, I see no change, and that's the same through 2011. In 2012, at the age of 42, I'm seeing some early signs of jowling. And that's the area right here. We're seeing some fullness developing there as the cheek complex starts to see some of the effects of gravity. It starts to move down and in, and as it does that, you start to get this jowling that forms right around some of the ligament. And as that tissue comes down, you start to lose some of the definition of the lower jaw. But as I talk about in many of my other videos, the strong bony structure to our midface and lower face is going to partially protect us against some of the effects of gravity and some of the sagging that can occur. In 2013, at the age of 43, I see no change. And in 2014, at the age of 44, I'm starting to see that there are more forehead wrinkles and the eyes are appearing more open. So maybe the dose of her Botox was lowered to combat some of those changes that were occurring around her eyes, with the eyebrows starting to feel a bit heavy. And as she's regained some of that ability to raise her eyebrows, the eyes also start to look more open. In 2015, at the age of 45, I see no change, and that's the same through 2017. In 2018, at the age of 48, we're starting to see some of that neck skin laxity building and becoming more visible. Sometimes what we see is that platysmal bands can form in the neck, and some people address that with Botox injections to try to weaken that muscle so that the bands are less prominent, and other people look to do surgery where they're basically cutting some of that muscle and then repositioning it and tightening it up. And the platysma or the neck muscles can be addressed in isolation surgically, but it can also be addressed as part of a facelift procedure. In 2019, at the age of 49, what I wanted to point out here is that the lip corners are starting to get a bit downturned in Melania's case. And this is very common as we are in our 40s and start to enter our 50s. And this is because of a combination of both volume depletion that occurs at the commissure itself, but also, of course, the gravitational drop that happens as we all age. Some people combat this with doing DAO muscle Botox injections. Other times, a deep plane facelift procedure might help with lifting that commissure from the inside. And there are also procedures like the grin lift, which look to remove a portion of skin out here by the commissure to lift that area. And the grin lift is specifically a procedure that I'm not a fan of because of the scarring that it leaves in a very visible location. In 2020, at the age of 50, I see no change, and that's the same through 2021. In 2022, at the age of 52, I am seeing that Melania's jawline looks a bit smoother, and the neck to me looks like it doesn't have as much of the redundancy or banding that I was seeing earlier. So perhaps she had a facelift, though it's not completely clear, and we're not really able to see her ears well to evaluate if perhaps the tragus has changed, or maybe the earlobe itself has changed because of a facelift. We can't tell because oftentimes her hair falls over the ears. So it's possible that she may have had a facelift, but it's also possible that she may have had a non-surgical procedure, such as a skin tightening, say radiofrequency procedure, that may have given her some of that tightness back without a surgical approach. Some of those radiofrequency devices are quite nice for the early signs of aging and to tighten up some of the areas. The problem is that when you later on consider getting a facelift, the facelift becomes more challenging to perform because of all the scarring that has occurred from the radiofrequency procedure. So the tissue planes are not as well defined, and it slightly increases your risk of, say, nerve injury or even bleeding during surgery because of that past exposure to, say, radiofrequency energy or some other heat energy. In 2023, at the age of 53, I see no change, and that's the same through 2024. The total cost of Melania Melania Trump's potential facial procedures is $203,000. Known for his striking looks and undeniable charisma, Henry Cavill has become a household name, leaving fans mesmerized by his on-screen performances and, of course, his ever-evolving appearance. From his days as Superman to his recent film Argylle, we'll explore the subtle changes and possible enhancements that have led some to speculate about the possibility of plastic surgery. In 2002, at the age of 19, you can see that Henry has a slight widow's peak. He also has full eyebrows that are horizontal in nature, and as we know, this is a very masculine type of trait. Henry has a prominent mandible, and he has very strong mental tubercles. Just like we have tubercles in our lips, as I've pointed out in many other videos, we also have these different prominences in different parts of our bony structure. This is different from a dimpling in the chin, which is usually caused by a dehiscence of the actual muscle that lives in that area. Here, we have prominent bony prominences just lateral to that mentalis muscle. He also has full tooth show when he smiles. Jumping ahead to 2007, where he's 24 years old. What you see here are forehead rhytids or wrinkles, and this is caused by the frontalis muscle. The wrinkles always run perpendicular to the underlying muscle. The frontalis muscle runs in this direction, so then the lines that you see on the skin surface are going to be horizontal in nature. Some people start Botox injections in their 20s and 30s as a form of prejuvenation, where they're trying to delay the onset of deeper wrinkles. Prejuvenation with Botox is a very different use case compared to filler injections. With filler injections, there's nothing preventative about it. You're only using it to cover up signs of aging that have already presented, or adjusting a certain anatomical feature that maybe you're not completely fond of. You can also see that Henry has tear troughs present. The left side is a bit more pronounced than the right. This is also called infraorbital hollowing, and it's something that most of us develop over time. Keep in mind that lighting has a strong impact on how our infraorbital hollowing appears. Even when we shoot these types of videos, we have a light that's directly facing me so that my infraorbital hollowing is not as obvious. Here's what happens when we turn those lights off. So now that the overhead light has been turned on and the lights facing me have been turned off, you can see that the infraorbital hollowing is a lot more obvious. And this will impact how Henry appears in various photographs that are taken of him, as it applies to everybody else. Henry also has good definition to his Cupid's bow. And this is an area that's very difficult to adjust. Some people ask me if there's a surgery that can better define their Cupid's bow area. The truth is there really is no surgery for that. Sometimes people use filler to try to adjust some of the contours of the Cupid's bow, but that does run the risk of looking somewhat artificial. Henry also has a similar volume between his upper and lower red lips. It's about a 1-to-1 ratio. In 2008, at the age of 25, Henry has a Norwood 2 type of hairline. He has that slight frontotemporal recession in the corners, but he does have preserved anterior temporal peaks. And keep in mind that when we talk about the forehead dimensions, it's not just how high up the hairline actually starts, it's also the projection anteriorly. So if you have an expansion of your forehead that goes up and goes out to the side, that's when the forehead starts to look bigger. And one of the ways that you can get that expansion laterally is with the temporal peaks starting to recede, as well as the frontotemporal areas. So when people come to my surgical practice looking for restoration of their hairline, one of the discussion points becomes, do we adjust anything with the temples or do we leave them alone? And that's something that we assess on a very case-by-case basis. Keep in mind that adding grafts to the temporal area does consume quite a bit of your donor supply, so we need to make sure that that's a good investment of grafts. Henry here has those low masculine eyebrows. When I look at his nose, what I see jump out at me the most is that he has a prominence to his left nasal bone. Remember that the upper part of the nose along the bridge is going to be your nasal bones. That's an actual bone, right? There's two nasal bones and they're joined right at the center. As you travel further down the bridge of the nose, that becomes cartilage. Even though it feels like hard bone, it's actually cartilage that you're feeling lower down on your bridge. When I look at Henry's nose, that left nasal bone to me looks like it kind of jets out, and it appears that way through the years. Henry has a strong jawline. That's one of his distinguishing features, and this is from a combination of different elements, which include the mandible size itself, the hyoid bone positioning, as well as the amount of submental fat. All of those things need to align in order to give you that very sharp type of jawline with the prominence that you see here. Let's say, for example, if his mandible was of a similar size and his hyoid bone was still well positioned, but he had that extra submental fat, now all of a sudden that contour would really change. Similarly, if he had a smaller mandible but a well-positioned hyoid bone and very little submental fat, it again would not look like it does in his case. So all three of those elements need to essentially align to give you this type of appearance. In 2009, at the age of 26, I see no change. In 2011, at the age of 28, I wanted to point out here that Henry's eyes are not the same. He has what's called segmental heterochromia. You can see a patch of brown in his left iris, but otherwise his eyes are blue. This is a phenomenon that's much more common in cats and dogs, but it's rare in humans. Most people are born with this trait, but some people can get it from injury or from illness. I think that this feature is inconsequential to his overall appearance, but it's something worth noting and something that's interesting to learn about. In 2012, at the age of 29, I see no change. In 2013, at the age of 30, Superman is now approaching a Norwood 3 type of hairline. You can see deeper frontotemporal recession, and now because of that, his widow's peak is even more pronounced. But his temples are still intact, and that again reduces the width of his forehead, even though the vertical axis is increasing in forehead size. Many patients come to me with this type of hairline configuration and they're looking for surgical enhancement to the hairline. But the most important thing with this type of appearance is actually to preserve it, because you can see in Henry's case and in many of my patients, there's still excellent hair in the frontal scalp, mid-scalp, crown, in those DHT sensitive areas. And the key is to protect that hair. It's much more important to do that than to actually get a hair transplant. A hair transplant can adjust some of the contours of the hairline, sure, but really the most important thing with this type of appearance at age 30, like Henry is here, is to protect the existing hair. And we talk about that a lot on the channel, and we have medications available for that purpose at feelconfident.com. In 2014, at the age of 31, you can see that Henry has now more prominence to his nasal labial folds. This is something that happens to all of us as we age, and it's not an area that we should constantly look to fill. Henry still has a nicely preserved neckline. And I don't think this is because he's been mewing. This is, of course, mostly due to his incredible genetics, and it's also coupled with proper dieting that helps maintain that neckline. In 2015, at the age of 32, Henry has this excellent beard. It's slightly more patchy on the left-hand side, and the cheek height level is slightly lower on the left than it is on the right. And these types of asymmetries are very normal when it comes to facial structure. He overall has a very symmetrical face, but this is one asymmetry that I noticed. And again, these types of asymmetry are what actually add to a person's attractiveness, whether you're a man or a woman. In 2016, at the age of 33, what I'm seeing here is that Henry has these bony changes, but I think they're likely due to weight loss rather than different types of injectables or buccal fat removal. I just think that most of this can be attributed to various changes in his weight, because you see it reverse later on as well. So it's not just his cheeks that narrow in as he loses weight, it's also the area around the eyes. That starts to look more hollow. And that is what happens as we lose weight or as we gain weight, then you expect a more global change in the face, not just in any one area. And so it was interesting to learn that Henry was actually teased in private school for his weight. They used to call me Fat Cavill, Henry told Men's Fitness in 2015. I actually had rolls of fat on me, he said. These early experiences, of course, shape who we become and how we treat ourselves and our bodies over time. I have this video about proving haters wrong where I go through some of my life experiences and how that shaped who I've become. So make sure to check out that video if you're interested. In 2017, at the age of 34, I see no change, and that's the same through 2019. In 2021, now at the age of 38, again, it looks to me like not much has changed, down to the exact upper lid creases that he had before. I've looked through many pictures, and it just seems to me like not much is changing other than the natural aging process taking its course. In 2022 and 2023, I see no change. In 2024, age 40, all I'm seeing here is more upper eyelid hooding. This, I think, is a combination of dermatochalasis, where our upper eyelid skin gets a bit more baggy, as well as lateral eyebrow descent. Those two things are usually what account for a more hooded upper eyelid appearance. I think he looks quite natural and very youthful for his age. From soap operas to Real Housewives of Beverly Hills, Lisa Rinna has been in the spotlight for many years. Has plastic surgery played a role in her changing appearance? In 1989, at the age of 26, you can see here that Lisa has a prominent widow's peak, and that's the area right at the center of the hairline. It's a slight projection down that gives the hairline a characteristic look. She has about equal horizontal thirds of her face. Her eyebrows are arched closer to the lateral canthus of the eye. Usually the most arched part of the eyebrows occurs between the lateral limbus of the eye and the lateral canthus of the eye. She has nice supratarsal show, and her nasal tip to me appears more narrow than it was in high school. When we look at photos from her in high school, there is a bit of a tip bulbosity, and when you follow the bridge of the nose from the top down towards the tip, you see that there's a bit of a splay as you get to the tip. In these more recent photos, I don't see that same effect. So I wonder if she had a rhinoplasty sometime between high school and age 26. This would have been to make the tip more narrow, to have a more uniform width to the nose from the bridge down to the tip. Lisa appears to have full tooth show on smile, and she has a strong jaw structure. In 1991, at the age of 28, Lisa's lips do appear to be fuller. She did admit to silicone lip injections sometime in her 20s. This would have likely been with a micro droplet approach, where these small injections of silicone are placed into the lips over several sessions to start to build up their volume. Keep in mind that there's no dissolving agent when it comes to silicone, so it's not like the currently used hyaluronic acid fillers that you can dissolve with hyaluronidase if you're not happy with them. With the silicone injections, you're pretty much stuck with them unless you go and cut them out. And the silicone injections can look good initially, but then what happens is that they create a lot of distortion in the lips later on. And we have more on that later in this video. In 1992, at the age of 29, what I'm seeing here is progressive enlargement of Lisa's upper lip. Now, this was likely due to the several sessions of silicone that she has admitted to having. With each subsequent injection session, the upper lip became fuller and fuller until her desired appearance was reached. It also looks like Lisa may have had a chin implant around this time. Her chin appears to protrude down more, and it's now more narrow compared to her original chin. In 1993, at the age of 30, I see no change. In 1994, at the age of 31, what I wanted to point out here was that her upper to lower lip ratio used to be about a 1:3, whereas now it looks like that ratio is closer to a 1:1. So the upper lip appears to be of a similar size to the lower lip. Now, while that is a ratio that does exist in nature, most people have a bottom lip that's a bit fuller and larger than the upper lip. That's a more classic presentation of lips, and also a more classic understanding of beauty standards, even though those standards are somewhat changing, and they continue to change over the years. In 1995, at the age of 32, I'm wondering if Lisa may have had some implants placed into the jaw closer to the gonial angles. So previously I mentioned there may have been a chin implant placed, but now what I see is there's additional width to the lower face. And the whole architecture of the lower face to me appears to be changed compared to prior. It was a much smoother transition up from the chin to the side of the face, and now there's a bit more of a boxy type of appearance, and it looks like maybe there's been some prominence added to the gonial angles, and the material that would have been placed at that time was most probably still silicone. Silicone chin implants have been used since the 1950s. In 1996, at the age of 33, I see no change. In 1997, at the age of 34, what we're seeing here is a continued change of the upper lip. The shape is now appearing to have a lateral prominence. So the portion that's out to the side on both sides seems to be more full and seems to be hanging down more. And you can even see how it covers up some of those upper teeth. And in 1998, at the age of 35, I see no change, and that's the same through 2000. In 2001, at the age of 38, again, looking at the upper lip, there's irregularity at the wet-dry junction. So previously we were seeing just a fullness forming on the lateral aspects of the upper lip, but now we're seeing this irregularity developing. And that's again related to the changes that occur with silicone injections as time passes. In 2002, at the age of 39, this may have been around the time when Lisa started to get Botox injections. Botox became more popular in the early 2000s. So areas like the forehead, the glabella, and the crow's feet are the most commonly injected zones, and it looks to me like Lisa has a fairly frozen forehead, glabella, and crow's feet. With facial expression, you really don't see much movement in those areas. And in 2003, at the age of 40, I see no change, and that's the same through 2005. In 2006, at the age of 43, I wonder if Lisa had cheek implants placed around this time. There is now more medially and laterally based volume in her cheeks, and there's more of a blurred lid cheek junction. Some people place these malar type of implants or submalar implants. As those implants are placed, it reduces that lid cheek transition. You see less of the tear trough as that implant is placed to push those tissues up. Other ways to reduce the appearance of the tear trough include placing filler and also a lower blepharoplasty that can take the fat and reposition it over that trough. And yet another way is with a fat transfer to again blur that transition and reduce the trough. And in 2007, at the age of 44, when we compare back to 2003, you can see, especially on this right side, the lateral cheek is now protruding more. So there's an architectural change there that I don't think is explained with just fillers because of how regular that shape is, especially bilaterally. So I think that shape may have been due to the placement of a cheek implant. In 2008, at the age of 45, I see no change. And in 2009, I also see no change. In 2010, at the age of 47, Lisa did admit to an upper lip reduction. She was very public about this, and this is a surgery that I do in my practice, and this is something that I do for patients with a history of silicone lip injections, but also people who were just born with one part of the red portion of the lip being a little bit more full than the other, or they may have had prior traumas or other types of surgeries that may have left them with an area of prominence that doesn't look in sync with the rest of their lips. So for those patients, we do an upper lip or a lower lip reduction where we're basically removing the portion that's sticking out. And with silicone specifically, what patients think is that I'm going to go in there and I'm going to see every little speck of silicone. And that's just not the case. We're really not seeing the actual silicone. We're just seeing the areas of prominence, and we're going after those areas and removing just the right amount of tissue so that we can create more evenness and a smoother type of junction right at the wet-dry area of of the lip so that it doesn't look like there's extra tissue. Also, some patients report that when they have that kind of tissue prominence, they might be biting on that tissue and that tissue gets irritated and then it actually grows even more. So it could affect even things as basic as eating. So sometimes a lip reduction is done for functional purposes and other times it's done for just aesthetic purposes, and sometimes it's both. So that's something to keep in mind with lip reduction surgery. And I use dissolvable sutures, so there's nothing that has to be removed. And it's overall a very reproducible, consistent, and a high satisfaction type of procedure. In 2011, at the age of 48, I wanted to point out here the philtral column definition that Lisa still has. And even though she's in her late 40s now, that definition persists, because in many patients when they're younger it's quite defined, the Cupid's bow, the philtral columns, and as we age we lose that definition. But in her case it's still there, and the reason why it's really difficult to recreate with non-surgical or surgical types of methods is because the primary reason why you're seeing the definition is because the central portion of the philtrum is actually depressed, or it's indented, right? It's concave. That's what you're seeing as far as the definition, rather than the columns being so high up and protruding up. And so that's really where the difference is. When you do a surgical approach to try to recreate the columns, or you inject it with filler, you make those lateral columns stand up, but the center is still quite flat and in line with the tissue around it. The trick is to have that depression, and that's very difficult to create, right? So if you have it naturally, great. If you don't, then you're kind of stuck. In 2012, at the age of 49, I am seeing some signs of a potential brow lift with or without an upper blepharoplasty. There's now increased supratarsal show, and there's increased hollowing of the upper eyelids. And these are some of the unintended effects of brow lifting with or without blepharoplasty, because you're essentially creating more space in this region. And yes, you want to remove excess tissue, but it's actually quite easy to remove a bit too much and then have this type of hollowing and also have an increased platform here. And usually it's not a big deal and few people will realize it. And in Lisa's case, I think the area still looks extremely natural and it was well done. The brows weren't lifted too much and not too much skin was removed from the upper eyelid, but yet there is a change there, and I can appreciate that compared to prior images. In 2013, at the age of 50, Lisa's upper lip appears to have returned in its lateral fullness. So even though she had the lip reduction procedure 3 years prior, now what you're seeing is essentially a return of that tissue. And that is something that we see with lip reduction surgery, especially when it's done for a history of silicone injections. That silicone can continue to migrate around and the tissue continues to form, like scar tissue and other nodules. And then you get this relapse tissue that, again, to resolve, you would need to go back in and do another lip reduction. In 2014, at the age of 51, I see no change. In 2015, at the age of 52, I do see some signs of jowling forming, and also there's now increased submental laxity. So that's the tissue of the neck as we start to see the effects of gravity and of general volume loss in the face. The tissues tend to sag, and that's where you start to see this kind of crepiness in the neck and additional platysmal banding forming as well. In 2016, at the age of 53, I see no change. In 2017, at the age of 54, what it looks like to me is that now the upper to lower lip ratio is closer to 1.5 to 1. Now the upper lip is really larger than the lower lip, and part of this has to do again with the history of silicone injections despite having had the lip reduction, and part of it is that our tissues continue to atrophy with time, so that bottom lip is starting to see a reduction in volume, and yet that upper lip is still having that fullness from those injections and the scar tissue that had formed. So now you have this discrepancy of that upper to lower lip ratio. In 2018, at the age of 55, I see no change, and that's the same through 2020. In 2021, at the age of 58, late, I do see some signs of a potential facelift. So there's now reduced jowling, the neck skin appears to be tighter, and when I compare back to say 2004, when you look at the sideburn area, there's less hair there than there was before. And that's another sort of giveaway for facelift procedures. So in addition to some of the tragal changes that we talk about, some patients will have a reduction in the sideburn hair. And that's because as the incisions are made to remove that excess skin during a facelift, some of that skin will carry with it some of those sideburn hairs. They're usually removed because it's hard to hide the scar in those finer hairs. So the scar is hidden in the temporal hairs. But as you do that, along with the skin that you're removing, usually those sideburn hairs go as well. Keep in mind that if those hairs are lost, you can recreate the appearance of a sideburn with a hair transplant. And that is something that I do in my practice for patients who've had facelifts in the past and they have maybe some scarring or maybe some lost hair. It could be here. It could also be in the back, depending on how the incision is created in the back. Some people lose hair down here, and that also is kind of a giveaway for a prior facelift. So some people will come in for a hair transplant where we can conceal those scars pretty well and restore the appearance of their hair. In 2022, at the age of 59, I see no change. In 2023, I also see no change. In 2024, at the age of 60, it looks like she may have had some fillers placed into different parts of her face, but also what I'm seeing is that there is some general fat reduction that's occurring. As that occurs, the implants, if we have facial implants, become more obvious because the fat starts to basically atrophy away around different parts of the face, and then the areas where we have implants, they stick out more. And Lisa was also public about her use of the Skin Vive treatment. This is a newer type of filler that involves a micro droplet injection of hyaluronic acid, similar to the micro droplet injections of silicone that she had in her 20s, but now this is a hyaluronic acid-based filler, so there is the potential of dissolving it, but it's basically marketed as a way to not increase volume of the face and just give it hydration that's long-lasting. But it is injected into the superficial layers of the skin, so it does have the potential to add some volume because hyaluronic acid is a sponge, so it's going to attract water and it's going to swell. So even though they say that it's not supposed to give you additional volume, what Lisa discovered and what many other people are discovering is that it does in fact increase that fullness of your face. If you want to hydrate your face but not have facial swelling or an increase in facial fullness, then you essentially need topical formulations of hyaluronic acid. So like a hyaluronic acid serum, for example, and there's a very good one at feelconfident.com if you want to check it out. By combining different molecular weights of hyaluronic acid, there are ways to still penetrate into some of the superficial layers of the skin and hydrate the surface without giving you that added volume. And the total cost of these potential procedures is $270,000. Anya Taylor-Joy, has the mesmerizing actress from Mad Max had plastic surgery? Let's delve into her facial transformation and examine her journey over time. In 2015, at the age of 19, what we see here is a natural asymmetrical hairline. So you can see that in Anya's case, the left side of her hairline comes down lower than the right side, and it's very common to have this asymmetry at the hairline, and that's what gives it a very natural appearance. When you look at her forehead, specifically at the bony composition of her frontal bone, especially as you come down to the glabella, what you see is that she has a flatness to the glabellar area, the area between her eyebrows. And this is a very feminine type of appearance. Generally in women, there is no projection of that frontal bar, whereas in men, there's usually a harshness to that frontal bar. So when facial feminization surgery is performed, one of the common procedures is actually to shave away at that frontal bar so that you can get a more feminine appearance. And of course, in Anya's case, she has that appearance at baseline. She also has a smooth transition from the lower lid down to the cheeks on both sides, and this is again a sign of youth. when we look at her nasal tip, we notice a mild bulbosity, which comes from the curvature of the lower lateral cartilages. And when I look at her perioral region, she has well-defined philtral columns, and the Cupid's bow is also very well defined. And when we trace her upper vermilion border, there is an arching to the shape of it. It looks rather convex, and that is in contrast to other people who have a much flatter architecture to their upper vermilion border. And in Anya's case, this is a very distinguishing feature of her overall facial appearance. And for many people who get lip lift surgery, this is the type of appearance that they can expect post-operatively. But in her case, she's starting off with that kind of baseline arching. She also has a strong bony composition to her face. When you look at the mid-face and the lower face, the actual bony structure is quite strong and prominent. In 2016, at the age of 20, what I notice here is her large open eyes. And this again is a very distinguishing feature of her overall look and something that really stands out. She also has nice full eyebrows that draws more attention to that whole periocular region, and that again brings the eyes out even more. In addition, she has that pillowy infrabrow fullness and a very well-defined supratarsal crease on both sides. I often talk about facial asymmetry and how we all have some degree of it. In Anya's case, it looks like the right side of her face is a bit more full compared to the left, and you can see that in the cheek volume, and you can even see that in the gonial angle as well. The right side has a different architecture compared to the left, and that's something that is seen in all people. And I actually think that that has something to do with the fact that the right side of her hairline is higher than the left. And I honestly noticed that in most people, the right side, for whatever reason, seems to be the more dominant side of the face. And that is the fuller side where the bone seems to be a bit more developed. And I think that's part of the reason why we notice that in about 90% of people, the right side of the hairline in men and women tends to be more recessed than the left. I think is an interesting observation. In 2017, at the age of 21, I see no change. In 2018, at the age of 22, what I'm seeing here is some upper tooth show on repose, meaning that when Anya just opens her mouth, you can see those upper teeth. And that is again something that we associate with a more youthful, sensual type of appearance. And that is why when people consider lip lift surgery, for example, they're looking to get some upper tooth show, because that's something that's commonly seen in models and actors on TV and also on billboards and in magazines. When you look closely for men and women, if they part their mouth and you see the upper teeth, that's a very characteristic model-esque type of appearance, and it tends to portray this more youthful type of appearance. And again, in Anya's case, she just has that naturally. And that, coupled with the philtral definition and the distinct nature of her Cupid's bow, makes for an attractive look. In 2019, at the age of 23, I see no change. In 2020, at the age of 24, I do see some signs of potential plastic surgery procedures. The first is a brow lift. So when I look at the area underneath the eyebrow and right above the eyelid itself, that distance has lengthened to my eye. She's always had nice brow position right at the orbital rim, with the arch of the brow extending slightly above the orbital rim, which is not uncommon in women. And now the entire brow complex seems to sit just north of the supraorbital rim. And that again just seems different from how she looked prior. While Botox can help sometimes lift the lateral tail of the brow, it usually doesn't cause the entire eyebrow to go up. I'm also seeing some potential signs of a rhinoplasty with alarplasty. To me, the tip of the nose, the bridge of the nose, both appear more narrow, and also the ala, or the wings of the nose, appear to be thinner now compared to prior. And these are all areas that can be adjusted and refined in a single nasal surgery. And these are often many of the goals that people have when they're considering undergoing a nasal surgery. They're looking for things to be smaller. They're looking for things to be more narrow. Those are common requests. And it's always a matter of balancing those requests with making sure that the patient can still breathe appropriately and that they still look quite natural after their surgery. I would say that in Anya's case, she looks great. The nose looks well balanced. It doesn't look like too much was removed. It still looks very much like her. So these are all signs of great rhinoplasty surgery. And remember, some people get their rhinoplasties done with a closed approach where the incisions are hidden on the inside of the nostrils, and other people get it done with an open approach where part of the incision is right here, right at the mid portion of the columella. If done well, it doesn't really matter which approach is chosen because this incision becomes nearly invisible once that healing has taken place at the scar line. The skin tends to be quite thin there, and usually the incision heals very well in that location. In 2021, at the age of 25, I see no change. And in 2022, I also see no change. In 2023, at the age of 27, I'm seeing some signs of a potential buccal fat removal. To me, the area where the buccal fat normally lives looks more hollowed on both sides. Other options could include some general weight loss that may have affected the face. Also, sometimes with makeup contouring, it might appear like that area is more hollow than it actually is. Again, we don't know for sure, but because buccal fat surgery was so popular last year, it's possible that she may have undergone that procedure to give that type of more model-esque appearance where you have the more pronounced cheekbone and that hollowing in the buccal fat region. In 2024, at the age of 28, I do see some signs of veneers placed here. So sometime within the last probably 2 years, I think she had some veneers, at least for the central and lateral incisors. And she also seems to be wearing lighter type of lipstick, and also her hair seems to be of a lighter color. And that, I think, also gives off a different general appearance. It's interesting to think how makeup changes the characteristics of our face and might give the illusion of certain procedures being performed or just an overall different composition to our face. I think with this lighter complexion, there's now even more emphasis on her beautiful eyes. When you look at her face sort of zoomed out, the first thing that my eyes jump to are her eyes because of the darker eyebrows and because of the size of her eyes and the darker color of the eyes. All of those elements bring more attention to that region. Versus when I look at her at age 19-20, there's a lot more attention that's being drawn to the lip area. And that could very well be partly because of the choice of lipstick color. So makeup has a tremendous ability to steer our eyes to different parts of the face depending on what the person wants to emphasize and what areas they want to stand out. And as I've said in some previous videos, the strong cheekbones and lower jaw will be somewhat protective for Anya from the overall aging and sagging process that occurs. The facial aging process seems to evolve a bit slower when these cheekbones and jawbones are more robust. And the total cost of these potential facial procedures is $80,000. Some people think that Harry Styles is actually bald, like me. They say that he's wearing a wig and that he's actually lost his hair. I'm gonna take a look at his hair and address this conspiracy once and for all. In 2010, at the age of 16, Harry has what looks like to be a Norwood 1 pattern with strong anterior temporal peaks and little to no frontotemporal recession. In 2011, at the age of 17, this is a common hairstyle for Harry in his teenage years, with his hair coming down and covering part of his forehead. In 2012, at the age of 18, now it looks like Harry has more of a Norwood 2 male pattern. To review some of the basic terminology, we have the widow's peak, and that's this area right here at the center of the hairline. We also have frontotemporal corners, or the frontotemporal recession areas. And of course, we have the temples that are located just south of the frontotemporal corners, and they're right above the sideburn area. You can see that Harry's temples have started to recede laterally. His temples are now further away and pulled away from the eyebrows than they were just a few years prior. He has a strong hairline with some baby hairs present as well. In 2013, at the age of 19, Harry here has a similar hairline pattern. Either he's preserved this pattern naturally, or he may have started on something like finasteride. We know that finasteride has a strong ability to prevent further hair loss in most men. Keep in mind that some men will experience really significant hair loss in their teenage years. I've even seen some Norwood 7 cases in, say, 18 or 19-year-olds. And that's an important reminder when we start to consider doing hair transplants at younger ages. Of course, we have to be careful when offering a hair transplant to a younger patient. However, when someone has such an advanced pattern in their teenage years, what would be the reason to wait even longer to offer them a potential transplant? Something to consider. And I would argue one of the wrong medications to start on when you're starting to see frontotemporal recession at a younger age and you want to prevent further loss would be topical minoxidil. And I have a whole video on why I think that's not a great first choice. But unfortunately, that's where most people start and their hair loss continues. In 2014, at the age of 20, you can see that Harry has deeper recession on the left frontotemporal corner compared to his right. And this occurs in only about 10% of the population. In most people, usually the right side recedes more than the left, and that's true in men and women. So Harry Styles is in the minority with his hair loss pattern. Keep in mind that the younger you are when your hair loss starts, the more potential you have to end up with a more advanced pattern of hair loss at a younger age compared to someone who just starts to thin and recede later in life. This of course makes intuitive sense because if you're already starting to have significant hair loss in your teenage years, how will it look when you reach your 20s, 30s, and beyond? So the population where finasteride has the strongest potential to really help limit progressive hair loss is in this younger population, which of course is the population that's least likely to be A, interested in a medication that they have to continue to take the rest of their life, and B, compliant with the medication because of all the other things that they have going on in their lives at that age. In 2015, at the age of 21, I see no change. And in 2016, at the age of 22, I also see no change. In 2017, at the age of 23, you can see that Harry Styles' crown is still quite strong. Remember that the main areas of the scalp, especially when it comes to the DHT sensitive zone, is the frontal scalp, the mid scalp, and then the crown. The crown on all of us has at least one area of a whorl pattern, and that's where the hair starts to rotate on itself, and that gives the appearance of some subtle thinning in everyone. This thinning is mainly due to directional changes that are occurring around that whorl. You lose that shingling overlap effect that you may have on other areas of your scalp, such as the frontal area. In 2018, at the age of 24, I see no change. In 2019, at the age of 25, Harry is moving towards a Norwood 3 hair loss pattern, specifically on his left side. He's starting to develop more pronounced hairline asymmetry, but his overall hair density is still quite strong. So in my opinion, in a situation like this, he's unlikely to benefit from minoxidil, whether that be the topical formulation like Rogaine or oral minoxidil that we know is more potent than the topical minoxidil, but is only meant to increase the thickness or the caliber of our hair shafts. And as it does this, it gives us more hair fullness, but it's not going to bring back hair in areas where you've completely lost it, like in Harry's case, the frontotemporal corners. So if he came to me for clinical advice, I would say thumbs up to finasteride for reducing progressive loss of those areas and keeping the great hair that he has at this time point. But the use of minoxidil is unlikely to change much for him clinically. It would only expose him to some potential side effects. And the additional recession that we're seeing on his left side suggests that he's either not on finasteride or he's on finasteride, but he's falling into the 8 to 10% of men who continue to see progressive hair loss even even on the standard dose of oral finasteride at 1 milligram a day. Some men who are on the 1 milligram a day dose feel like they're doing everything possible to prevent further hair loss, or if they continue to see progressive recession. But oral finasteride in its standard dose will be effective for preventing hair loss in about 90 to 92% of men. The rest might have to consider bumping up the dose of finasteride or switching over to its more potent cousin, dutasteride. The difference is that dutasteride blocks all the isoforms of the 5-alpha reductase enzyme that's blocking the conversion from testosterone to dihydrotestosterone. If you're looking to reduce your hair loss, make sure to check out the products that we have at feelconfident.com. In 2020, at the age of 26, I see no change. In 2021, at the age of 27, I see no change. In 2022, at the age of 28, this is around the time when rumors started to swirl that potentially Harry Styles had a wig or a hairpiece. It definitely does not look like that to me. He still has a natural hairline and his usual degree of recession. He has those finer hairs that are blending into his thicker hairs, which is very natural. And he also has some irregularity along the hairline that's very difficult to recreate with a hairpiece. And that left side being more receded than his right is still very much in keeping with what he had previously. So there's no reason to think that he's now wearing a wig. But in November of 2023, at the age of 29, Harry debuted a shaved head for the very first time. And some speculated that this was a reaction to the release of a Taylor Swift record called 1989 that she released 1 month prior in October of 2023. And in that record, she actually referenced Harry's hair. But maybe it wasn't because of that record. Maybe it was because of something else. In 2024, now at the age of 30, what you see here is that the contour of Harry's left frontotemporal corner now looks different. It looks less angular, it looks less receded, and it looks more rounded and more symmetrical with his right side. However, his temples and his central hairline appear unchanged. So my hypothesis is that Harry's head shaving 1 year prior was actually related to a potential hair transplant to balance out the contour of his hairline. Now, this was a subtle type of hair transplant. This wasn't something involving 3,000 grafts. This was something that may have only involved about 200 to 500 grafts, likely with the FUE or the follicular unit extraction method from the back of the scalp into that left corner. And they likely shaved his head for that procedure. And I think that's why he debuted that shaved head in 2023. If this is true, it really shows the power of today's hair transplant surgery, how it can restore balance and symmetry to the hairline in a very natural way. This wasn't possible in the past, but with today's technologies and the proper artistic vision that I'm always talking about on this channel, it is possible to have a hair transplant and to have nobody notice that you did it. From her early days on the Disney Channel to her current status as a pop sensation, Sabrina Carpenter has captivated us with her incredible talent and stunning looks. But many wonder, has she undergone cosmetic procedures to enhance her appearance? In her teenage years, what we see here are high, full brows. She has nice infrabrow fullness and supratarsal show. When I look at her nose, I see a narrow nasal bridge. And her upper to lower lip ratio is about a 0.9 to 1. She does have upper tooth show on repose, meaning when she just parts her lips. And she has a strong upper and lower jaw, including a strong gonial angle, and that's the angle of the jaw right in here. What that does is that it increases the width of her lower face, and that can be caused by the actual thickness of the jaw itself, or sometimes by the muscle that overlies it called the masseter muscle. You may have heard that some people get Botox injections into that muscle to try to reduce its strength, whether that's for helping them with TMJ pain or potentially to reduce the width of the lower face. But that muscle or its underlying bone can add to the lower facial width. In 2017, at the age of 18, Sabrina has nice youthful cheek fullness, and that fullness is more medially based, meaning closer to the center of her face. And that really works in youth, but as we get older, some people try to recreate that with filler, and it can look somewhat artificial, especially as the face starts to sag and medialize and move down. That extra weight in the medial face with filler can at times look a bit unnatural, but in a youthful state, it is very natural appearing. And I wanted to point out here that the nasolabial folds are very much present, and this is how it actually looks in a more natural state. So when people try to again use filler to efface the nasolabial folds, things can start to look a bit more artificial because you're starting to blur those boundaries, those facial subunits between, for example, the perioral area and the cheek complex. In a natural state, those boundaries are more well defined with things like the nasolabial fold that serves as the boundary between those subunits. And I also wanted to point out here what I think is a distinctive characteristic of Sabrina's face, which is that the philtral columns are not well defined. So in some people, you have quite a bit of depth to the central area of the upper lip where the philtrum lives, and you have the philtral columns on either side. In Sabrina's case, the area of the upper lip is flatter and there's less of that indentation between the philtral columns. And that gives her quite a distinctive look. In 2018, at the age of 19, when I look at Sabrina's profile view, what I'm seeing here is that she has a more rounded type of forehead, and that can sometimes give the illusion of a larger forehead. But it's not that she has a large forehead. It's not that her upper third is much larger than the middle third or the lower third, but what gives it that illusion is how much roundedness there is to the forehead itself. And that might be one reason why she seems to use her hair to hide partially some of her forehead. Now, it might have nothing to do with that, or the roundedness might have something to do with her actual hairstyles. Keep in mind that the size of the forehead is not just its height centrally, but also the width of it laterally. So how far out it goes to the sides will also dictate if it looks like a larger forehead or not. Some people have quite a short forehead centrally, but as you go out laterally, there's quite a bit of width, let's say from the tail of the brow to the actual temporal hairline. And so sometimes when I'm doing hairline work and looking to help frame the face, it's not just bringing down the central hairline, but it's also bringing in the lateral hairline, because that can also shrink down the overall appearance of the forehead for people who are bothered by that. Also on profile view, what I'm seeing here is a small dorsal hump. So as you come down from the radix of the nose down towards the tip, you can see that there's this slight convexity to the nasal bridge, and that's that small little hump. In 2019, at the age of 20, Sabrina seems to be using makeup to highlight certain aspects of her face. For example, when you look at her cheekbones, there's a bit more definition there, and I think part of that is because of the shadowing that's placed underneath the actual cheekbone, and that gives the cheekbone a bit more of a pop. Also, I do think that she's starting to overline her upper lip, and that's starting to create more of a one-to-one upper to lower lip ratio. But I also see some signs here of the potential introduction of lip filler, both to the upper lip and to the lower lip, to add some hydration and a bit more volume. As we know with lip filler, it's important not to overdo it. You don't want the lip to start to stick out anteriorly to project forward, because that's what gives that ducky appearance. So avoiding the actual vermilion border when you inject is very important in trying to prevent that type of appearance. And I think that they've done a very nice job in Sabrina's case of not overfilling the actual vermilion border. In 2020, at the age of 21, I see no change. In 2021, at the age of 22, what really stands out to me here is how thick Sabrina's eyebrows are. It's quite in vogue again to have thicker eyebrows, and there are different ways in which people can achieve that look. Now, for some people, it comes down to just using more makeup. Other people might try some tattooing or some more permanent type of makeup or even microblading. Yet others will sometimes go for eyebrow hair extensions that get glued on. And there's another method called an eyebrow hair transplant, which isn't as common, but it's something that I do in my practice, and we have dedicated videos on that subject, and that can really help enhance, especially after someone's done a lot of plucking or their eyebrows are just naturally thin. But I think in Sabrina's case, her eyebrows are naturally quite full, and she's sporting them, which I think they look great. Also, what I think we're seeing here is potentially the introduction of cheek filler. When I compare back to this image of her in 2017, what I'm seeing is that now there appears to be more laterally based volume in her cheeks, as opposed to her more original organic state, which is more medially based volume. So now there's this extension out laterally, which starts to bring more of that width to her upper face as opposed to just the lower face. Some people will actually get cheek implants to achieve a similar appearance, but I think in her case it was probably cheek filler that was added to the zygoma region of her cheek to fill out that lateral component. And before I continue, I just wanted to thank everyone who's tried our Feel Confident skincare and hair care products. We made them from scratch with love. We put amazing ingredients in them, and we tried to keep them affordable. So thank you guys for showing your support, and for some of you for even becoming brand ambassadors, which is really cool. And for anyone who hasn't tried the products yet, make sure to head to feelconfident.com to try them for yourself. In 2022, at the age of 23, I see no change. In 2023, at the age of 24, I'm seeing some signs of a potential tip rhinoplasty. So to me, Sabrina's bridge looks untouched. It has the same width as it did when she was in her teenage years, but now the tip appears to be more narrow. It's similar to the width of her bridge, whereas before the tip was wider. And these results are less obvious than when the hump is also taken down. So many celebrities will actually leave some convexity to their nasal bridge with that hump and instead just get their tip more refined. That's harder to spot than when the whole nose is redone. And when we compare back to Sabrina at age 16, we really start to see that difference to the nasal tip, whereas the nasal bridge looks quite similar. And in 2024, at the age of 25, when I look at Sabrina's lips, to me, the upper lip looks more arched. And I think that's probably from the continued use of filler. I don't think she's had a lip lift. So with the overlining and the additional filler, that's given her upper lip quite a nice upper arch. And that's something that is sometimes difficult to achieve naturally with filler, but I think her lips still look great. So this was likely done with small, tasteful amounts of filler over years to create this appearance. This is not something that you just go in, get 1 syringe of filler or 2 syringes of filler at one time and call it a day. This is something that's done gradually with a very calculated approach, and I think that she still looks youthful and natural and does not look like she has overdone lips. And the total cost of these potential cosmetic procedures is $40,000. From her days as San Francisco's district attorney to her current role as vice president of the United States, many have noticed changes in Kamala Harris's appearance over the years. Today, we'll explore her journey, examining whether these changes are a result of natural aging, makeup techniques, or perhaps even plastic surgery. In 2001, at the age of 37, what I'm seeing here is that Kamala has a prominent widow's peak. That's the area right here at the center of the hairline. In some people, the center is not as pronounced, and it might look like the center is just in line with the rest of the hairline. But in others, it looks more like the center has its own prominence where there's an extension down towards the rest of the forehead. And we see this phenomenon in both men and women. I'm noticing that there are some signs of brow descent in this photo, especially when you compare back to her teenage years. And we know that there are signs of aging that can be seen in all of us in as early as our late 20s. And especially as we hit our 30s, we start to see parts of the face starting to descend. Kamala has good medial cheek volume, and she has less of that cheek volume the more lateral you move along the zygomatic arch. When she smiles, you have nearly full upper tooth show visible, and her Cupid's bow is quite well defined. But in contrast to the Cupid's bow, the actual philtral columns are less defined. Kamala also has a strong chin, and you'll see why that's relevant later on in this video. In 2003, at the age of 39, what you see here is good supratarsal show with some lateral upper eyelid hooding. And this is related to that lateral brow descent that we talked about previously. As the eyebrow, especially the lateral portion, starts to gradually droop, it brings the upper eyelid with it. And what that creates is increased eyelid hooding. Sometimes it's the skin itself that's starting to stretch out. But in these earlier years, it's more that the lateral eyebrow is starting to slowly droop. I'm also seeing a scar on the right lateral orbital rim. It's unclear what might have caused this, but there is that small scar there, and we'll see it present in later years as well. And now in her late 30s, you're starting to see some lower facial laxity. The ligaments of the face will gradually loosen, and you can see that starting to happen here. In 2004, at the age of 40, what we see here is under eye hollowing, and that is sometimes referred to as a tear trough. Now that is in part caused by some of the fat content in this area starting to slowly diminish. And what that leads to is a distinction between the actual lower eyelid and the cheek itself. Some will look to correct this with fillers, while others might get a lower blepharoplasty to reduce that distinction between those two areas. But that is a delicate area, and it must be handled with care. And in this profile view, what I'm seeing is some minor nasal convexity. And what that really means is an upper nasal hump. It's rather small in Kamala's case, and it's not too obvious, but it is there, and I think it brings some nice naturality to the area. Some people look to reduce that hump as part of a rhinoplasty, while other people get rhinoplasty surgery for, say, the tip of their nose, but they actually don't want the hump addressed because they feel that it connects them to their roots, to their culture, and just gives them that distinctive appearance. So everyone has a different opinion on how they feel about their hump. Personally, I'm very happy with my nasal hump. In 2005, at the age of 41, that scar that I mentioned previously is more visible in these images. Scars on the face can be addressed in different ways. Sometimes people go for laser resurfacing, that can help, but you have to be sure that the type of laser is properly picked to match the skin type of the person. Also, the depth of the scar might change your treatment of choice. Other times, when the scar is too wide or too deep, we might address it with a surgical excision and revision of that area. Other techniques for scar could include microneedling, and some people are even applying exosomes topically to help with improving the quality of the scar. Sometimes in more delicate parts of the face, we might employ fat transfer techniques where we benefit from the stem cells that are in the fat to help rejuvenate the quality of the skin, in addition to allowing the filler component of the fat to improve the contour of that scarred region. In 2006, at the age of 42, I see no change. And in 2007, at the age of 43, what we see here are those natural forehead rhytids or wrinkles. They're running perpendicular to the actual fibers of the forehead muscle called the frontalis muscle. Some people end up getting Botox or other neurotoxins to reduce the appearance of those wrinkles or to sometimes eliminate them. But as you introduce neurotoxin to the forehead muscle, you have to keep in mind that that's the only muscle that actually lifts the eyebrows. So if you go to paralyze it, that might actually weaken the eyebrows, giving you some brow descent or ptosis. And for some people, they rather not have the brows descend down, so they avoid the frontalis, and other people will actually inject smaller doses to the forehead to try to not paralyze it too much, But sometimes that can have a paradoxical type of effect in that you'll try to work harder to raise those eyebrows, and in so doing, you actually create more wrinkles. So there is some controversy on whether or not the frontalis muscle should be treated with neurotoxin. And that discussion came up in my podcast with Dr. Doris Day. So if you're interested in learning more about that, make sure to check out our podcast. In 2008, at the age of 44, when you look at the midface, you can see that there are some signs of general volume depletion. Remember that the two main ways that we show aging in the face is first the descent of the tissues, and that has to do with gravity, of course, and the second is volume depletion, as we lose those qualities to our skin, to the muscle, to the bone, that at a younger age gives us that vitality. As we grow older, the integrity of those tissues starts to weaken. And you can see that Kamala has upper tooth show on repose. So when she just parts her lips like this, you can see some upper teeth. And that gives off the appearance of a more youthful face. In 2009, at the age of 45, I'm seeing that Kamala is starting to overline her upper lip with makeup. When you compare back to 2001, her upper lip looks a bit fuller, but I think this is less likely to be filler based on some of her more recent photos. I think instead of filler, she just chose to use makeup to overline that upper lip and give the appearance of a fuller, taller upper lip instead of going the route of filler. As you know from my other videos, a lip lift can also increase the overall volume of the upper lip. In 2010, at the age of 46, what I see here is that Kamala has these horizontal neck rhytids, or wrinkles, forming in the neck. This is sometimes improved with a facelift procedure, but usually it doesn't completely get rid of these horizontal lines. Some people are just more prone to getting them, and one approach to help reduce the depth of those lines is the use of filler. But no matter what technique you use, those lines are difficult to completely resolve. And just like we talked about the horizontal wrinkles of the forehead being formed perpendicular to the fibers of the frontalis muscle, so too when you look at the neck and you look at the fibers of the platysma muscle, these horizontal wrinkles are running perpendicular to that neck muscle. In 2011, at the age of 47, I'm seeing some signs here of potential veneers. This is a very common procedure to help correct some dental imperfections and to also give a different coloration to the teeth themselves. In 2012, at the age of 48, what I wanted to point out here is Kamala's excellent skin quality. Remember that the darker one's skin is, the more melanin it contains. Melanin in turn protects us from harmful UV radiation. That leads to fewer wrinkles and improved overall skin quality. But no matter how much melanin someone has, sun protection is still very important. And great skincare is also very important. And for the best skincare products, make sure to check out our Feel Confident products. In 2013, at the age of 49, I see no change. In 2014, at the age of 50, when I look at Kamala's left eyebrow, what I see is that the body and the tail of the brow don't have much hair. She may be using makeup or microblading to help recreate the appearance of a fuller brow. Some people also get eyebrow hair extensions, or in some cases, eyebrow hair transplants to bring hair back to the eyebrows. And when I look back at her photos, it looks like at least since 2001, there's been a hair deficiency in that area. Now, this could be from several different potential causes. One is just not being born with much hair in the mid to lateral eyebrow. Some people get eyebrow alopecia from overplucking, while others might experience some traumatic event like a deep cut on the eyebrow that then leaves them with some hair loss. Yet other people have some thyroid deficiencies that might lead to a thinner eyebrow. And conditions like mine, alopecia areata, can also sometimes affect the eyebrows. There are also some scarring alopecias like frontal fibrosing alopecia that leads to the hairline getting higher as well as the eyebrows thinning. In 2015, at the age of 51, I see no change. And in 2016, at the age of 52, I I also see no change. In 2017, at the age of 53, what we see when we look at Kamala's forehead is that the rhytids, or the wrinkles, are now becoming more static. So previously, they were just there when she animated or, like, say, raised her eyebrows. Now we're seeing more of those wrinkles at rest, and that's what happens over time. Eventually those lines get etched in. And in Kamala's case, I still see no signs of a facelift procedure. Her sideburns are still present, the tragus looks very natural and does not look modified, and she has jowling and neck laxity that seems to be increasing. In 2018, at the age of 54, I see no change. In 2019, at the age of 55, what I'm seeing here is that there's nasal ptosis when she smiles, and this is often absent after a rhinoplasty. When a rhinoplasty is performed, oftentimes the nasal cartilages are locked in and they're sutured together in a way that the nose no longer moves when you smile. But when someone has not had a rhinoplasty, you see these natural changes, like this small droop of the nose when she smiles. And remember, when you're comparing the nose from one year to another, you have to see if the patient is smiling or are they not smiling. When we smile, our nose widens. That's a very normal type of effect. Also, depending on how close we are to the camera itself, the nose might appear bigger as we get closer or smaller as we move further away. And that, again, is a normal phenomenon and something that needs to be looked at closely when you're trying to figure out, has someone had a rhinoplasty or not? I'm also seeing here that Kamala's crow's feet wrinkles are now more pronounced. And I wanted to point out here, going back to what I mentioned early in this video, that her strong chin has been, I think, somewhat protective against more advanced tissue descent or the appearance of more aging in the neck and in the lower face. Our underlying bony anatomy matters for how we age. The weaker the bony anatomy, the less likely it is to support our tissues, and the more likely they are to droop faster and for more laxity to develop. And the sooner then we would show our signs of aging. In 2020, at the age of 56, I see no change, and that's the same through 2024. The total cost of these potential cosmetic procedures is $50,000. Do you agree with this analysis, or do you think that Kamala Harris has had more cosmetic procedures? Comment below. Let me know which celebrity or politician I should cover next. And don't forget to feel confident.